This is the KRON 4 Morning News.
Hello, everybody. Welcome to our 2 live hours of KRON 4 News Weekend this Sunday morning.
Also, we are going to turn the spotlight on an issue that could become a huge problem for parents, and for some parents it already has. There's a 300% increase in prescription drug use among teenagers. So we're going to talk about that with a well-known addiction specialist and also talk about his recovery program in Marin County.
On a very important topic, there is a growing epidemic among teenagers and their drug use, but it's not always marijuana or other illegal drugs.
We're talking about major dependence on prescription medications. There's been a 300% increase in prescription drug use among teenagers. Joining us to talk about that this morning is Dr. Howard Kornfeld. He's the founder of Recovery Without Walls program in Marin County. Dr. Kornfeld, thanks for joining us. What types of drugs are most popular now amongst teenagers?
Well, they often start with something like Vicodin, which is a form of hydrocodone, very commonly prescribed for a sprained ankle or post-operative care. And then often they will start to take these drugs from their parents' medicine cabinet way before they're even exposed to, let's say, alcohol or marijuana.
Do they do it because they want to use it themselves, or they want to share it and sell it? Which is the most common?
Well, I think usually they're curious. Teenagers are experimental. They want to find out what things do. They've seen prescription drugs advertised on television. They see their parents take it. They don't think it's dangerous. And they figure, let's take one or two and see what happens.
Well, the 300% increase is shocking. Give us a sense of at what age children are beginning to try these prescription drugs.
Well, even as young as 12 to 16, this has become a problem. Now, of course, once they experience a altered state of consciousness that they like from their parents' medicine cabinet, then they could go out and buy this from dealers on the street, and the problem can grow. And they're not necessarily educated about this because we've been maybe too much focused on things like marijuana, things like alcohol, and we haven't yet focused on this problem.
You talk about, let's see, their pain medications, their sleeping pills, and their stimulant medications, so it runs the gamut. Is there a particular group of kids that's using this, or is it across the board for kids?
Well, I think it's common, and it's, of course, the kids that are more prone to it are the kids that, let's say, have depression, or the kids that have anxiety. And they will take these pills, and all of a sudden they'll feel better. And their response, because they don't know better, is to get more of this. And a lot of times they could then become dependent, particularly on an opiate drug. And once you're dependent on an opiate drug, there's drug withdrawal. And so to prevent drug withdrawal, they'll keep obtaining it. And some of these high school kids actually look good initially on these drugs because, let's say they solved a depression problem, they start to do actually better, and so it's completely undetected at first by their parents or even their peers.
What are some, two-point question here, what are some warning signs for parents to look out for, and what can parents do? Okay.
Well, when your kids become a little bit irritable, when they start isolating, when they stop talking to you, any of these signs are...
Some parents would say that's a normal teenager.
Right. Precisely, but yet it's very important to do that, and it's very important to talk to kids in a way that they feel comfortable coming to the parents with anything, that they're not going to be punished if they talk. And one way to also is to ask them about their friends. Sometimes they won't talk about themselves, but you could talk to them like, are your friends using? How is that going? And often they'll come forward with that.
Tell us about your Beat Your Addiction program. We've not got a very long time, so if you could tell us what it's like and how successful it's been.
Sure. Well, this summer we decided to focus on teen addiction, particularly the teens that get addicted to pain pills like the Vicodin or the OxyContin, because these teens need help. They often need a special drug called buprenorphine. We often think of the buprenorphine or Suboxone as for an older patient or an addict, but these kids need it to get off the drug. And so Beat Your Addiction is a summer program that we decided to focus on so we could get these kids in July and August, get them off of these drugs and get them to college, because otherwise they're going to lose a whole year or two of college if we don't get on top of it.
But there's more than using drug therapy. Do you do...
Precisely. What we do is we do psychological help, we do spiritual help, because the 12-step program is so important, the Alcoholics Anonymous or the Narcotics Anonymous. And with this entire program and good nutrition, good exercise, these kids can really make a turnaround quickly.
And this really does affect virtually the entire economics stratus in the Bay Area, doesn't it?
There's no division by class. Both rich and poor are afflicted with this illness.
And I take it what you're saying is if these kids don't get this problem under control now, this could really drag them down the wrong road.
Precisely.
Okay.
Unfortunately, we have to go, but thank you for joining us.
Thank you very much.
Thank you.